Good morning. I'm honored to be here. I'm honored to be part of the forum, and I'm honored to have been part of the team that put this program together, a true team. We're going to be doing a lot over the next day and a half. I'd like to take just a moment to give you a little bit of background, some context, and go over just a few logistics. Welcome to members of the forum, to our speakers, our panelists, our guests here in person, and our guests who are here through the webcast from around the world. The program that you're participating in over the next day and a half has been built on the experiences of a diverse group, and the experiences of the Institute of Medicine and the forum. For example, in 2007, there was a workshop on preventing violence in low and middle income countries. Just earlier this year in February, we had a workshop on violence and mental health. So we've been able to draw on a lot of what's occurred in the past to put this together. As Patrick alluded to in regard to a previous workshop, what we've done is not without limitations. The people involved in putting this together brought tremendous perspective from a variety of fields. The background on forum members and the roles they play are in your packets, so I won't take the time to go over them now. But I ask that you read them so you can see who's been involved. As Patrick said, we'd like to acknowledge the support of our sponsors. This wouldn't be happening without them. The CDC Foundation for what we're doing today and the commissioning of the papers. The Joyce Foundation, again, Nina, thank you. The New Venture Fund, and of course the forum members. For those of you who don't know, this is the 9th public workshop that the forum has sponsored. And in response to a question in Fran's essay, this is the group that has mustered the will to change. The planning committee had a tough task in narrowing down what we're going to focus on in the next day and a half. Means of violence is a complex issue, as you can well imagine. Where do you put your priorities? Where do you put your attention? We're focusing on the tools, the means of violence, but it's near impossible to separate a discussion about the means of violence from the causes of violence and the people who perpetrate the violence and the outcomes of violence. But as best we can, we're going to stay focused on the means. And we ask you to help us through your participation to do that. The continuum of violence, as we looked at the means, ranges from continued and realistic threat against an individual to the massive violence we're seeing around the world today. Large-scale acts of terror and annihilation. Narrowing this down wasn't easy. It was quite stressful. In matters related to violence, people don't care about the politics. They don't care about their government's internal issues. They don't care about budgets. And to a very appreciable degree, they don't care about research and analysis. They certainly don't care about the media's flavor of the day. They care about living in peace, living in safety. And they want us, people in positions to affect change and influence our society, to cause that to happen. The desire to end violence isn't bound by culture, or nation, or ethnicity, or race, or religion. For the purpose of this workshop, we're focusing on the World Health Organization's definition of violence, which most of you know. It's pretty typical of definitions you find elsewhere, so I'm not going to take the time to read them. The basic definition is the one I want to get across. It's the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community that either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. The operational definitions break down, and they're available to you. So again, I won't read them. I'll let you just glance at them momentarily. Now, we on the planning committee have some expectations for you today and tomorrow. This is your workshop, and all of you, those who are participating as speakers and presenters, those of you on the forum and those of you who are here as guests, bring value to it. We need you to do that. We want you to share your experiences, your research, and most importantly, your ideas on where we need to go when we're done. This is the beginning. It's not the end of the forum's look at means of violence. Again, we'll be drawing on workshops that have occurred in the past, more so than the ones that I've described. We're limited by time. We have to stick to the schedule, and time inhibited what we're able to cover. We ask you to help us by sticking to the schedule. I love all of you, and as much as I'd like to hear from you at great length, we do not have the time to pontificate. Ask your questions, be brief, make statements, be brief. Help us stay with the flow and stay on schedule. Please take advantage of the time allotted to interact during breaks and during meals. At the forum last February on violence and mental health, that was a spectacular time. The connections that were made and the things that resulted from the sidebar conversations. Make that happen again. Please respect confidentiality. People may share with you information that hasn't been published, personal experiences that don't want shared. Above all, put your cell phones on vibrate or turn them off. And most importantly, enjoy the next 2 days. I'd like to give special thanks to the planning committee. Evelyn, Steve, our new members to the forum, staff, Kimberly and Louise, absolutely phenomenal. We were a team, and with relatively short time, I really believe accomplished a great deal. And again, thanks to our sponsors. But most of all, thanks to all of you for being here. Thanks for all you've done. That's what's gotten you here. And thanks for all you're going to be doing in the next day and a half. I appreciate it very much. I'd now like to turn it over to Jim Mercy.